morning and welcome to Health Hour by Apollo 24/7. This is the show where we bring you Apollo's health experts every Sunday to the live show, and you can ask your queries and questions. If you're watching this on a Facebook page or if you're watching this on YouTube, you're welcome to ask your questions. But I prefer the questions. We prefer the questions on YouTube. If you want to ask a question, please do give us full details like your age, your gender, and other details if possible in one question, so that I'll be able to give the question to the doctors in one go rather than searching for everything. And also on this show, you can win gift coupons and discount vouchers from Apollo 24/7. Today, as you know, we are talking about tips on quitting smoking. How do we quit smoking? If you've ever tried, if you have at least once tried quitting smoking, you know how difficult it is. So you need professional advice, and here we have two experts today. One is a pulmonologist and other is a psychiatrist. So let me invite our experts today. Our first expert is Dr. Kripesh Ranjan Sharma, Senior Consultant Pulmonologist and HOD from Apollo Hospitals, Guwahati, and 13 years plus in experience there. He's a professional member in American College of Chest Physicians, Indian Chest Society, Chest Council of India, and European Respiratory Society. So he is going to give us some wonderful tips on how to quit smoking and what kind of damage smoking does to our lungs. That will be Dr. Kripesh Ranjan Sharma, who will be joining us very shortly. And our other expert for today is Dr. Debanjan Banerjee, who is a consultant geriatric psychiatry, Apollo Multi-Special Hospitals, Kolkata se hai, more than 10 years of experience. He is a professional membership. He has professional memberships in SARC, Psychiatric Federation, Life Fellow, World Psychiatric Association. He's a fellow of Indian Psychiatric Society. He can be consulted for geriatric psychiatry, dementia, Alzheimer's, sexual medicine and health, trauma, psychopharmacology, and also psychotherapy. Hello, good morning, Dr. Debanjan Banerjee. Welcome to the show.
Hi, very good morning, Lakshmi, and to our audience as well. Thank you for having me here. Very good morning.
Wonderful. Very good morning, and you are joining us from Apollo Multi-Speciality Hospitals, Kolkata. So we have, and Dr. Kripesh Ranjanji, good morning. Welcome to the show.
Good morning. Good morning.
Good morning. So we just finished your introduction, and it's good to have you both here. Let me just remind you of one advertisement a long back. I had seen this and it had made an impact so much. Key earlier days, it seems they used to by fashion, they used to promote smoking so much that they made doctors have a cigarette in their hand to make it look cool. And today we have doctors who are sitting out there and screaming lungs out, saying that do not smoke. So from there to here, we've learned so much about smoking, but why are we not able to quit smoking? Dr. Kripesh, quickly, I would want you to announce again, how is smoking detrimental to our health, especially lungs?
Yeah, definitely. For a long time, smoking has been considered to be a symbol of pride or something good thing. But we have lots of complications associated with smoking, particularly tobacco smoke. Any kind of smoking and tobaccos are injurious to our health. And smoking can affect any part of our body, not the lungs, but any part of our body. But since I'm a pulmonologist, I will primarily focus on how smoking can affect our lungs. So particularly, our lungs are prone to develop COPD. Lungs is prone to develop cancer, and then tuberculosis again, which is a very much important for our country, and also recurrent infection and lots of issues, particularly associated with secondhand smoke. Because we ignored the person who exposed to secondhand smoke. But again, if you see the data, every year we have around 8 million people die because of smoking, and 1.2 million people die because of your secondhand smoke. So that's why we have to be very much aware of the amount of effect the smoking can have in our body, in our society as well.
It is a very important and a very rattling fact that you shared with us, Dr. Kripesh, because it is not just the person who's smoking, but the passive smoking or the second-hand smoking, which is also equally important. Dr. Debanjan, my question to you today in the opening session would be, I know that there are so many health issues which can come out of smoking. What is it that prompts a person to pick up that cigarette? I know it starts with the peer pressure or that curiosity or that little, let me do that adventure. And then how does it become a vice or addiction?
Yeah, thank you, Lakshmi. See, firstly, let me just thank you for picking up this topic. I think, as you said, smoking has been really normalized in our lives and society so much that it is no longer nearly considered to be even an addiction, which is concerning. Now, like any other addictions, it's just that first one that makes the difference. Now, we had this National Mental Health Survey, which was conducted by NIM Bangalore, my institute where I was for a long time. So what came out was nearly 80% of the sample had nicotine addiction in different forms, not just smoking, in chewable tobacco as well. But very few of them actually seek help. So that's the concern. And coming back to your question, it's that first kick, that first go, that first cigarette, and the memory of how you feel with it, that really triggers our brain to ask for more. And one of the very common things is, it may be a myth, it may be to some extent a misconception, is that smoking relieves stress, and that is the reason why many people even take to. In fact, mental health disorders, depression, a lot of people think that smoking relieves depression. And that's the other reason why a lot of people take to smoking. So, yes, it's the first take, the first smoke, of course, peer pressure, and not to mention linking smoking with personality, feeling cool or, feeling masculine, that sometimes starts off with the addiction.
Gender free right now, we have everybody smoking. So the population is now, it's not just one gender, it's also women, it's also other genders who have are participating in this kind of culture. Where let's while I'm looking at the questions which have already started to pour in the YouTube, let me quickly tell my audience that if you're trying to ask me a question here, if you want your question to be placed before these experts, kindly put in all the details in one. Do not chop your questions. Please put everything into one so that will be easy for me. Nani is asking this question. Nani Naidu, I'm a software professional. Due to pressure, I smoke a lot. He's just 27-year-old. I'm not able to quit smoking. Dr. Debanjan, do you find this age group more vulnerable? And this is where the long innings start?
Yeah, and as you rightly said, there isn't actually any gender difference related to smoking. But to be very frank with you, the damage that nicotine does, not only to lungs, brain, to any other organs, is actually much more in women, and especially if it starts at a very early age. Yes, the age group of rather 15 to 30, or to narrow it down, late teens and early tweens are more vulnerable because, the brain still has certain developments which make it more vulnerable. And it is often seen that if smoking starts at an early age versus if smoking starts later age, the complications, especially with relation to the effects on the brain, the effects on nervous system, the effects on memory. Dr. Kripesh already mentioned about the effects on lungs. They're very different. Also, if we talk about the reward circuit of the brain, that I take something which is addictive, I feel good about it, and then I go and proceed to the next one. This is what we call the reward circuit primarily. That is more vulnerable in the younger population. So the tendency to go ahead, increase in number of cigarettes smoked per day, and getting the kick out of it is much more in this age group, and hence smoking starts pretty early during this time.
Okay, so Dr. Kripesh, I would now want to turn towards you कि अगर smoking बाकी organs को भी damage करता है, but primarily it affects lungs the worst. I understand that tar is the substance which हमें पता है कि road पे use होता है, काला होता है, sticky होता है, एक बार पकड़ता है तो नहीं छोड़ता है. So what amount of tar is being our lungs are being exposed to when we smoke cigarettes, and how much of tar, how many of cigarettes, and what is the duration of smoking that is going to affect the lungs? Can you please give us a picture there?
Yeah, definitely. Look, there is no definite amount that this much of smoke or tobacco is harmful. Any amount of tobacco or any amount of smoke that patient get exposed is harmful, because we don't have a minimum cutoff limit. One thing. Secondly, lungs is just like a filter. Whatever you inhale, it will filter the worst thing, and the amount of tar, it may be in the amount of tons of tars will get deposited over years when patient keep on smoking. So when we look into during the bronchoscopy, we look into the lungs of a smoker's lung, you can see it is lined with some black color patches throughout the airways. So if somebody smoke and who see those pics, they will get scared of it. So that is one thing. And then the people think that I will smoke this much and this will not be harmful, or if I smoke less than 1 year or 2 year, it will not cause much harm to me. But actually these facts are not like that, because any amount of smoking can be harmful. But the more you smoke, the you have more ill effects. So suppose a small amount of smoke will cause minor problems, but if you keep on increasing, suppose if you have smoked for more than 10 years, your lungs tend to develop more COPDs and more complications. But the most important thing is that what is the benefit of quitting smoking, because they have a definite cutoff kind of thing, that if we could quit smoking, then it will do certain beneficial things. So that people should understand. So even a little bit of
Lovely, lovely
smoking.
point. Let me add a question there. I know
Yeah,
that smoking is damaging my health, but I want to quit smoking. So that
yeah.
one decision is going to help them. In which way is it going to help them? Dr. Kripesh, you go first, and then I go to Dr. Devanjan.
Yeah, definitely. Because when the patient quits smoking, there are certain changes occur in our body. Okay, so within 20 minutes, our heart rate and blood pressure will drop, and it will start to get normalized just within 20 minutes. If you see within 12 hours, the carbon monoxide level in that we inhale through smoke will start to be going towards a normal range within 24 hours. And within 2 to 12 weeks, our blood circulation will improve, and lung function will start improving within around 12 weeks period. Then within 1 to 9 months, we'll have the person's smoker's cough will start improving. If the patient
That's
develop breathing difficulty, that also start improving. And within 15 years, the risk of developing your coronary heart disease will be as equal to a normal individual. So these are the immediate cutoff or timeline benefit that patient will have once they quit smoking.
wonderful. Dr. Debanjan, so what are the other benefits, especially when one's addicted to nicotine and other tobacco related issues? So, what are the benefits of quitting tobacco?
Yeah, Dr. Kripesh actually beautifully explained about the different timeline of changes, and it is just before starting this off, I would like to mention a quick point. I mean, I just thought of adding it to what Dr. Kripesh mentioned before. So the common discussion that happens around smoking is cancer. You
Correct.
talk to anybody, and that's the irony is that there is much to stake than just cancer. You start, there used to be a figure in one of our medical books explaining right from the brain to the limbs, starting right from memory problems to lungs to problems with sexuality, problems with reproductive system, right to problems in blood flows in the limbs, which is called Raynaud's disease, where basically you can even lead to loss of limbs, which smoking can lead to. So there is much more at stake. And imagine each of these problems can actually be prevented and most of them be reversed if that one decision to quit smoking takes place. In fact, the effects on the brain, primarily on memory, on processing speed, on thinking, on the different areas of brain that function, they start to get reversed within a week of the last cigarette. And we
Wonderful.
all tell that this that you mentioned, this decision, this thought that I have to quit, I think this is primarily the most important thing for quitting smoking. Everything comes after this. Many times, when people are forcefully brought to us who do not intend to, I always tell them that if that thought doesn't strike your mind that you have to quit and you have to reverse the health effects for better health, that's the start. And once that starts, everything else will fall in place.
That's an important point. Does this have to start from the person, or does it have to be an enforcement on the person? For example, there are our society says public spaces में smoking मना है, of course for the larger good of the society. That is an enforcement. There are areas where you cannot smoke, or designated areas to smoke. The other way of approaching is parents or family members or friends who are bringing a person to say, hey, help him please. So the call for the help, where should this start from, and why is this important? Dr. Debanjan, you quickly touched about it, a little more deeper onto it.
Yeah. So, see, we all know about the COTPA Act, right? The Cigarettes and Other Tobacco Products Prohibition of Advertisement and Regulation of Trade and Commerce Production, Supply and Distribution Act. It was
Yeah.
amended recently in 2020 as well. Now, the thing is, restriction of smoking in public places, increasing the age of legal procurement of tobacco to 21 years, restricting the advertising of tobacco. Well, these almost look a little bit surrealistic, idealistic. We can do that. We can, of course, those are needed in terms of policy provisions. But what is important is, uh, implementation, and that becomes difficult. So, as I was telling you, we had the conversation clinic. We are either brought to us by their family who have different complications, and then they are brought to us, or sometimes we get referrals from our colleagues, pulmonologists, other specialists, medical specialists, that this individual has, it's quite addicted to smoking, so what can we do about it? Now, it's important to understand that there are a lot of myths that exist in this regard. As Dr. Kripesh was mentioning, I used to smoke 30, now I smoke 10. So it's okay. I'm fine with it. I have cut down by 2 cigarettes. I'm okay with it. And another problem is this e cigarettes. I've changed to e cigarettes. So I'm okay with it. Let me clarify this in this show that in proven that e are not safe.
ठीक है.
So there is no point of changing.
डॉक्टर देबांजन, आप जो बहुत इंपॉर्टेंट पॉइंट बोल रहे थे, आपका टेक्निकल स्नैक की वजह से ऑडियो कट हुआ. आई प्लीज रिपीट कीजिए, एंड मल्टीपल लैंग्वेजेस में रिपीट कीजिए. बंगाली, हिंदी, तेलुगु, तमिल, व्हाटएवर लैंग्वेज दैट यू कैन, प्लीज रिपीट एंड रीट्रेट दिस फैक्ट.
Yes, so I was mentioning, I hope my audio is clear now, that one of the myth exists that I have cut down the number of cigarettes. আমি সিগারেট খাওয়া কমিয়ে দিয়েছি, আমি আগে থেকে কম সিগারেट खाई, स्मोकिंग हमने कम कर दिया, पहले 30 लेते थे अभी 15 लेते हैं, तो अभी ठीक है. ऐसा नहीं होता है. Smoking, if it needs to stop, it needs to stop, and that's only when the health effects tend to change. And also, very importantly, changing to e-cigarettes doesn't really help. আমি যদি নর্মাল সিগারেট না নিয়ে ই সিগারেট নিই, তাহলে কোনো রকম হেল্প হয় না. সো এই জিনিসটা আমাদের বোঝার দরকার, যে যদি যতক্ষণ না পর্যন্ত আমরা শুরু করছি যে হ্যাঁ আমি সিগারেট বন্ধ করব, আই নিড টু স্টপ স্মোকিং, দ্যাট ইজ দ্য ফার্স্ট স্টেপ, and we need to take that ourselves rather than us being forced, because to be honest, as humans, we cannot be pushed to do things till it really comes from inside, and that's the basis of any active behavior.
Yes. Dr. Kripesh, I would want you to add here with Gaurav Dagaji's question. Here's a question on YouTube. Gaurav is saying, yes, smoking is bad, but what about other forms such as hookah and vaping and other forms of tobacco, right? Dr. Debanjan also is pointing towards e-cigarettes. Now let's talk about the other forms which are equally bad as smoking.
Yes, definitely. Any kind of tobacco smoke is bad, and any amount of tobacco smoke is bad. So, with any kind and any amount, that we have to keep in our mind. Many times, actually, people fail to quit smoking because they think कि just may एक पी लेता हूँ, just one will be good enough for them. But from that only, so they could not resist it. So ultimately, they fail to quit smoking. So any amount of tobacco smoke or any type is injurious to health.
Great. So here I would want you to talk about this
Let's
question, Rishabh. Yes, Dr. Debanjan, were you trying to tell me
sorry.
something?
Just yeah, just to add a very small point here. You know, I think we encounter a lot of people who come and tell us that I have smoked throughout 30 years. So now, what is the point really stopping? And what is the point if I just continue for the rest of my life? আমি এতদিন ধরে স্মোক করেছি, আমার এখন আগে আমার 20 বছর থেকে করছি, এখন আমার 50 বছর বয়স, क्या फर्क पड़ता है? What difference it makes? I just would like to tell all our audience here that it is never too late. If you
Yes.
really have to start reversing the effects of smoking, be it 20, be it 50, be it 70, it's never too late to start again having a healthy life prior to when your lungs first caught the tar.
Yes, Dr. Kripesh wants to add something here too.
Yeah, I would like to add one thing again regarding the importance of secondhand smoke, because he may have smoked for 30 years without any harm to him, but it doesn't mean that he haven't caused harm to his family members, his kids, and near and dear one. So that is important.
Yeah, and then Manju is asking this question, what's the chance of getting cancer? See, this is very important. We don't even know, it's not that point. So, Dr. Kripesh, would you want to add to it?
Yes, definitely, because smoking has a very close relation with lung cancer, particularly. And if you see, 80% of the lung cancer are smoking related. So that's why we have to be very careful. This may be a primary smoke or it may be a second-hand smoke.
Yeah, so here are now questions which are similar. People who are trying to quit smoking. Arthra Gupta, 41-year-old male, been smoking for last 15 years. Jitendra Singh Negi, 56-year-old male, smoking from last 35 years. Then also Vinod Vadvaji, smoking since 30 plus years, tried quitting several times but regretfully no success. He's 54-year-old. Then similar questions are Rishabh Upadhyay, 34-year-old. I want to quit, but I cannot. I cannot. I am smoking 10 cigarettes a day. I've tried many times, but I failed. So there is a case here. Everybody's story who was trying to quit smoking but not able to. Dr. Debanjan, before I get into the pulmonary section of it and the damage and then reversal of the damage, I would want you to throw light on what is the addiction center talking about this the stories everybody's talking about that I'm connected. All the stories are connected here with addiction. Why does this happen?
Yeah, thank you all for your questions and bringing this up. I think I would like to start by telling that the first step is, as I mentioned, you want to quit. Okay, that's kind of 20-30% of the work done. But also, quitting smoking is difficult. So, if you have tried multiple times, if you couldn't, with or without professional help, maybe, firstly, there is no need to worry. There is no need to be feeling guilty or feeling ashamed of it. We treat addiction like an illness. So, it is not your personal fault. If you are willing to quit, we are always there to help. Quick few things. One, if you want to seek professional help, there are different options. One, medications. Second, counseling. There are different strategies of counseling, and one of which is called MET, Motivation Enhancement Therapy or Training, where a person's motivation is taken through different stages. The goods, the bads are discussed with him or her, and it's a process. It's not that a one go one thing, but it takes its time. In terms of medicines, primarily what we use is nicotine replacement therapy. You must have heard about chewing gums, lozenges,
Yes.
patches. The patches, of course, are most effective, though even though a little costly. But they continuously supply nicotine to your body so that you do not really have that craving. Even when times of anxiety and stress. Not to mention, a lot of people who come to us for quitting smoking, we actually detect a lot of anxiety, depression, other mental health symptoms in them. So, once they are treated, we automatically see that the smoking comes down. অনেক সময় মানসিক সমস্যা, মানসিক অবসাদ এগুলো কিন্তু থাকে স্মোকিং এর সাথে। And finally, I think there are certain techniques which probably we'll discuss again later, like delaying, distracting, avoiding situations which will make you smoke, trying to avoid triggers. If I know that a particular movie or a particular scene or a particular group or a particular drink will make me want to smoke, I know these triggers, I can actually list them down and discuss with the psychologist as to how I can avoid them. I know it is said than done, but again, if there will definitely be a way. And professional help, like I said, is always there.
Wonderful. Dr. Kripesh, I would want you to add here, while somebody is trying to quit, it isn't easy, it is very difficult. But जैसे डॉक्टर दिबांजन ने बताया है कि आजकल ये जो निकोटिन के पैचेस हो या chewing gum हो, is it also equally bad? Will that affect lungs as well? Because here's one plus question. इनका नाम नहीं दिया, age and gender भी नहीं दिया है. I tried quitting smoking once. I did not smoke for a year. But I tried all the time. When I started to quit, I was feeling very sleepy all the time. My productivity drastically dropped, and he started cigarettes back. So these are the cases. These are practical difficulties. What would you want to
Yes, yes.
advise?
Yeah, usually we have usually 2-3 drugs available for quit smoking. Okay, so they also have certain side effect, but that's not much more. So particularly if we are talking about a nicotine replacement therapy basically. So we have a chewing gum or patches or even nicotine sprays are also available. Okay, but again, using a nicotine replacement therapy, we have to be little careful when the patient has some cardiac disease or not. We have to look for all the side effects before starting the therapy. But if there is proper monitoring is done, then these drugs will work wonder, and patient can be able to quit smoking. Then what the person is having that after quitting smoking, they have certain withdrawal symptoms. Again, to control then those withdrawal symptoms, they need a proper counseling from a psychiatrist on proper guidance, because if the guidance is not proper, they again this will act as a trigger to smoke. If I manage chordia and I am having this problem, now I take smoke and now problem is reduced. So these withdrawal symptoms we actually prevent them from quitting, and at this point basically they need a counseling and guidance from a psychologist particularly.
Yeah. So to add here, Asanik Sinestra's question, Dr. Debanjan, I'm directing this question to you here. Jamal is asking, I've tried quit smoking in the past, but I had bad withdrawal symptoms. I could not focus. I felt disoriented and energy loss as well. Can we handle these without nicotine alternatives? I smoke almost 10 cigarettes a day. Dr. Debanjan, would you want to answer this?
Yeah. So, yeah, the question. So, I think the nicotine withdrawal symptoms are, in fact, quite bad. Many of you are mentioning you feel restless, you feel jittery, person feels irritable. There is sometimes more sleep, sometimes less sleep. Uh, Tremors of hands start shaking. You find difficulty in concentrating at work. And it feels like it's better I just take that one cigarette to just so that all these things doesn't happen. Now, these symptoms can also be effectively treated using nicotine replacement. The route through which nicotine goes in replacement is different. It's inhaled. Of course, there are certain conditions in terms of heart, blood pressure and stuff, which can be. There are other medications as well, which can be tried to control these withdrawal symptoms. But importantly, I would request that instead of taking that extra cigarette to control withdrawal symptoms, maybe it's better if you can immediately seek help with any medical specialty. If they feel all our fraternities to the other person, if they feel like to me, but uh, usually the easiest way is that cigarette. Than that, the withdrawal symptoms can actually be dealt with, and also not very consistent like other forms of addiction, let's say alcohol, cannabis, or any other things. Nicotine withdrawal symptoms do affect the mind. They create a lot of mess with the mind, but they usually tend to cease if a person waits rather than immediately cigarette. They are troublesome, but they are not severe. So, with counseling, as Dr. Kripesh was mentioning, with certain streams of delaying, distracting yourself, providing nicotine therapy, and with certain medications and counseling, you can actually get over it. And we have many examples of people doing that.
Yes, yes. Thank you so much. Quickly, let me remind the audience. Now you can order medicines or book tests through WhatsApp number as well. There's a number which is running in the ticker. You can please make a note of it. You can WhatsApp or do a WhatsApp call on 9355 Apollo 24/7 is also now available on WhatsApp. And quickly, let me recap, because my audience are also watching it in Telugu here. Whatever you have said, Dr. Debanjan and Kripesh, let me quickly sum it up in Telugu. ఒకవేళ మీరు సిగరెట్ మానాలి అనుకున్న ఆ ఒక్క మాట చాలు. మీరు మానద్దు అనుకుంటే ఎప్పటికీ మానలేరు, కానీ మానడం కష్టం అయిన విషయమే, కానీ సులువుగా మానేందుకు చాలా రకాల ప్యాచెస్ కానీ లేకపోతే నికోటిన్ ని రీప్లేస్ చేసేటువంటి పదార్థాలు ఉన్నాయి. కాబట్టి అలాగే సైకాట్రిస్టులు, సైకాలజిస్టులు మీకు హెల్ప్ చేయడానికి సిద్ధంగా ఉన్నారు. మానితో వచ్చే బెనిఫిట్స్ గురించి డాక్టర్ కృపేష్ గారు చెప్పారు. ఇవన్నీ కూడా మళ్ళీ మనం సమాప్ట్ చేసుకుందాం. అన్నిటికంటే ముఖ్యంగా మానాలి అనుకునేటువంటి ఆ ఒక్క మాట మీరు మనసులో గట్టిగా అనుకోవడం ముఖ్యం. సో దిస్ ఇస్ ఇట్. క్విక్లీ ఐ విల్ కమ్ టు డాక్టర్ कृपेश जी. निश्चय चौहान जी पूछ रहे हैं, मैं ये काफी देर से देख रही हूँ कि ये क्वेश्चन कोई पूछेंगे या नहीं पूछेंगे. Any ways that we can reverse the damages of smoking, or is just leaving or quitting smoking enough?
Yeah, actually, I also often get this question, my friends who used to smoke actually. So the best thing is quit smoking and the quit smoking. Definitely, this is the only way actually you can reverse many harmful effects of smoking. And without quit smoking, nothing going to help you.
जी, तो मैं ना ये काफी बार मैं भी सुन चुकी हूँ कि देखो हम स्मोक करते हैं 1 या 2 सिगरेट करते हैं, पर उसके जो इफेक्ट्स है उसको कैसे रिवर्स करें. तो ये हो सकता है क्या? while you are accelerating, can you also break?
No, actually, definitely. Many people think that I will take some antioxidant and with that I can smoke 2-3 cigarettes per day. It will balance the harmful effect of smoking, or I'll do something like that, and this will balance, and I'll keep on continue smoking. But exactly this doesn't happen. This is actually a false idea that we bring in our mind to satisfy ourselves and to keep up ourselves to smoke continuously. That is actually not like that. There's the only way, and way you can prevent your harmful effect of smoking is quit smoking. That's it.
Great. So, Dr. Debanjan, here's the next question. I'm diverting this to you. Both of you, please feel free to answer this question. The question is Virat's question. 22-year-old male hai. I have quit smoking twice properly in my life till now. I still rebound, and he's rebound with smoking. Now I feel less motivated to quit smoking. Please help. Quite a young person, 22-year-old. Quit smoking twice already and is already on the rebound. देबांजन जी, ये साइकिल जो है इसके बारे में थोड़ा, quitting and then getting on, what does this do psychologically or psychiatrically? And Dr. Kripesh, what does this do when I start smoking physiologically to me? To first Dr. Debanjan ji.
Yeah, so it's Virat, right? If my name is correct, Virat.
Yes.
Yeah. So Virat, firstly, thank you for the question and congratulations that you have actually quit 2 times. Firstly, that's something you are not able to have done it. Now the thing is, probably you have to ask yourself that why did you less this time? Is it because smoking less number of cigarettes? Whether if the cigarettes are helping you? Each individual, smoking is a very, very common phenomenon, and World Health Organization shows that nearly 17% of world smokers are in India. It's a very, very common thing, but each individual has a different reason to smoke. हर कोई जो अलग मोटिवेशन रहता है स्मोक करने के लिए. Some stress, just for the kick, just because I am not able to quit, I just have the cigarette pack in front of me, or I just beside a shop and I buy them. So it's important that this cycle, in our terms we call it relapse. We quit and then we relapse into the negative behavior. Now, important fact is, let me just give one example. When you go to, you're from Hyderabad, okay, take the example of biryani. You go to a very tasty biryani shop, you have a very tasty biryani there, and then you come back, and next time, you know what our brain does? It's not that you crave for it automatically. That you have savored that food when you had that biryani, that entire circumstance, the people around, the taste, the look, the texture, everything is stored in brain as a memory, and that is played again. How did I feel when I tasted that? And that makes you go back to the shop and order that biryani again. Exactly the same thing happens for smoking or any other areas. How did I feel when I smoked my last cigarette? If it is a good feeling, you will go back to it. If it was not such a good feeling, it will act like a deterrent. So I think that is what the most important fact which many of us fail to realize. And if you are feeling nauseated, then probably smoking is giving you something, either psychologically or physically. For example, somebody going through a very tough time, the feels that if he smokes one in the morning, he feels more motivated to go to work. Now that we discussed with your healthcare professional, and that each individual having a different cue. I just like to add a small thing here, Lakshmi. We talk about dementia. We talk about Alzheimer's disease.
Alzheimer's.
No, forgetting. Yes, smoking is a very well-known risk factor for dementia. Very recently, last year, we all know about the Lancet. Lancet Commission brought out its landmark report, and out of the 12 risk factors, smoking is one of them. So if a person cuts down smoking from 20s to 30s, by the time the person is 60s, 70s, the risk of developing Alzheimer's dementia almost reduced to 30-40%. Imagine the
Thank you
number,
so much
the
for
magnitude
throwing
of
there.
damage.
Yeah. So quickly, another question that I want to ask Dr. Kripesh ji before I
Yeah.
want you to add. Said Jilani ji भी पूछ रहे हैं कि I want to know for how long the Nicotex gum can be consumed. I am trying to quit right now, but how long can I continue? So Kripesh जी एक और क्वेश्चन जो पहले क्वेश्चन के लिए ऐड करना चाहती हूँ कि अगर मैंने क्विट किया है स्मोकिंग and if I've got on to smoking again, what kind of additional damage is my lung exposed to? And if I repeat this cycle of quitting and then getting on, ये rebound जो हो रहा है, उसकी वजह से ज़्यादा damage होता है क्या? And also, if I'm using these additional gums or patches, how long can I use?
Yeah, so ideally the total duration of this nicotine replacement therapy is around 12 weeks roughly, but it can be also extended.
कि 3 महीने से ज़्यादा हम use नहीं कर सकते हैं.
Usually we give for 3 months. तो उसके बाद अगर case to case basis में we have to extend it, that we have to check the patient particularly. So by the time this is usually the patient, majority of the patient usually respond actually. One thing, then if the patient have rebound cycles of quitting and not quitting kind of thing, then what happened, they can also again restart the treatment. There's no problem. And secondly, this quitting attempt or in between if the patient smoke and the cycle keep on going, it doesn't harm the lung actually. Okay, this will because ultimately your total number of smoke is reducing. Okay, so but it's always end of the day it is important that you have successfully quit or not, because after quitting also there is a lots of window period, particularly 6 month period, where the rebound smoking can occur. And this 6 month period is very important because at this time the patients majority patient will start re-smoking or fail at this period. So at this period support and care from the healthcare provider is also necessary to make quit smoking successful.
Okay, so here are a few questions which are interrelated. Amit, who's 24-year-old, even after I made up my mind to quit smoking, I still end up smoking. What's the surest way to quit? Then there's a registered user. I'm having mild chest pain and increased heartbeats whenever I'm trying to quit smoking. So that's one. Another one, Dhruv is a 22-year-old male. I want to quit smoking, but each time I quit, my consumption increases multifold. So here we are talking about people who are trying to smoke and then getting back on more smoking. How can we help such a person?
Yeah, one thing, because certain during the quit attempt they stop smoking or reduce the but because of the triggers, basically most of the time they fail to avoid the triggers that can prevent smoking. So actually they have to avoid the situations where that can trigger smoking, like avoiding company of smoker, or the situation like going to pub or parties where they tend to smoke more, or the stress level that can trigger them to rebound smoke more. Again, certain things like they can feel that if I smoke one, then this is enough and I'll not have much problem. So that feeling that has to be cut off. And majority of time, one said that his heartbeat goes faster. He feels chest pain. He once he start quit smoking. So that is because of the withdrawal symptom. And again, for that he need the counseling and relaxation techniques. Sometimes this kind of feelings will occur after when a person attempt to quit smoking. So at this time, yogas can help them to relax their mind and avoid the urge to smoke.
ఓకే సో క్విక్లీ ये हिंदी అండ్ తెలుగు में भी मैं రీక్యాప్ करती हूँ ఒక మీరు స్మోకింగ్ ఆపేయడానికి ప్రయత్నం చేసినప్పుడు గుండె దడిగా అనిపించవచ్చు లేకపోతే ఎక్కువ బ్రీత్ చేస్తున్నారు హార్ట్ బీట్ ఎక్కువ పెరిగినట్టుగా అనిపించవచ్చు అయితే ఇది సాధారణమైన విషయంలో మీరు గుర్తించినప్పుడు కొంత రిలాక్సేషన్ టెక్నిక్స్ యోగా కానీ మెడిటేషన్ కానీ చేసినప్పుడు కొంత హెల్ప్ అవుతుంది అని డాక్టర్ కృపేష్ చెప్పారు ఆల్సో డాక్టర్ దిబాంజన్ when we talk about stress anxiety and then smoking people are stressed and then they go pull out a cigarette and feel that they are relaxed. Also, do you think that because they are smoking, their stress and anxiety are increasing? Because here's a question, Surya Upendra, 24-year-old male, how do I quit smoking? I have depression. Is it because of depression that Upendra is smoking, or is it smoke that is causing his depression? Is there a link between these two?
Yes, definitely there is a very important link between smoking and stress levels. It's both ways. Having depression, by that I mean just feeling sad is not. If having an anxiety disorder, temporarily the person smokes, he or she may feel that temporarily the anxiety comes down, but only after the effect goes off, there is going to be a rebound increase. And again, the person smokes, again it goes down, again there is a rebound increase. And it's a never ending process. On the other hand, somebody who didn't have depression or anxiety, if the person stops smoking, I mentioned withdrawals. So, इतने दिन में nicotine था, suddenly the nicotine goes down. So there are certain reactions in the brain and mind. Then the person starts feeling anxiety, starts having. That is not necessarily clinical depression, but that is due to the effect of nicotine going, not body not getting nicotine, and that is basically why we give nicotine replacement, so that have the withdrawal symptom, nicotine comes in the body, but it doesn't harm the body like it happens when we is that whenever we counsel people, we always sit with them and decide on a tentative date. Can be 2 months, it can be 3 months, but it usually has to be within a 6 months period. And very importantly, I actually would like to translate this. If we are not, somebody is not able to stop, we are not able to totally make the person stop. That we cannot get total. Let's say somebody smokes 20 cigarettes. Eventually, we settle down for some help. We call harm reduction. At least cutting down 2 or 3 every week, or cutting down on number, because number of cigarettes ultimately makes a difference. যদি আপনি জিনিসটা নিয়ে থাকেন, কমাচ্ছেন না, বন্ধ করতে পারছেন না একবারে, at least কমান, যতটা নিচ্ছেন সারাদিন তত কটা কমান, তাতেও কিন্তু কিছুটা।
All right. So thank you so much for putting that in Bengali as well for all the viewers who are watching you. Now this question is from Devabrata Das Gupta ji. Can you suggest some to Dr. Ranjan? I want you to answer this question. Can you please suggest some exercise to daily basis to strengthen our lungs, especially to those who smoke and cannot quit? And also something similar, I saw somebody who was trying to say, I still smoke and I would want to be fit. What are the ways to? So people who are smoking, how do they keep their lungs healthy is the question. I think repeatedly ये question आ रहा है.
Yes, yes. Till the person can able to quit smoking, they can continue to do regular exercises. The most importantly, there are certain lung exercises are there, like deep breathing exercises, and also pranayam. Pranayam is again a very good exercise for lungs that help us to breathe healthy air and keep our lungs clean from the bad air that inside our lungs. So that will also pranayam is one of the most important exercises they can do regularly, plus regular walking and a healthy food. Again, food, nutrition and diet is again important for our health, overall health. And also, if we have a good amount of antioxidant in our food, that can help our lungs healthy.
Sir, all of this, I understand that this is without smoking. While you're
Yeah.
smoking and doing all of these, I am not sure how much it's going to help. तो यहाँ एक और question है कि are there any tests to detect early detection for cancer, especially in a smoker? तो क्या होता है lung में कि how do we understand the effect of smoking, and are there any tests that one needs to get done if there is a smoker at home? Both of them, the smoker and the family member.
Yeah, definitely. The problem with our lungs is that the tests are there, they can detect it early, but the lungs is a very big organ, and by the time it gets damaged by 30, more than 50%, by the time patient perceive it that I have a problem, the patient symptoms start very late. One thing. Secondly, particularly talking about the lung cancer, its symptoms delayed almost when patient reached a stage 3 or stage 4, then only patient started developing symptoms. So there are some screening programs are there. These are not routinely followed in our country, but in US or abroad, they have a lung cancer screening program where they do a low dose CT scan to detect lung cancer if there are not in a particular smoker population or who has smoked for a longer period of time. So there are criteria and guidelines are also there. That is one thing. Second thing, there is a pulmonary function test or spirometry, or there are advanced lung function tests are there. This test can sometimes detect that early lung damage has occurred or not. Okay, so these are the way we can identify early changes, but it's always better to quit before some disease develop actually.
So, Dr. Kripesh, as you were talking, I'm trying to understand कि अगर कोई स्मोक करते हैं या कोई फैमिली में
हाँ,
स्मोक करते हैं तो उनको
हम्म,
PFT अगर करवाना है तो कितनी फ्रीक्वेंसी में
हम्म,
करना है to understand what
हम्म.
damage that their lung is going through. How frequently do they need to evaluate?
Yeah, definite. There is no definite cutoff, but actually, as we have in our Apollo Hospital, we have an annual health checkup system. Anybody, particularly those who smoke or get exposed to smoke, they should do a regular annual health checkup. Where we, in our health checkup system, we already have a process of doing lung function testing routinely. So, if the early problems are there, many a time it can be detected, particularly for bronchitis or COPD kind of things, can be detected early.
Okay. So one quick question from Rajendra. How effective are the smoking and de-addiction pills that we see which are being sold over the counter at chemist shops? Dr. Kripesh, would you want to add? And do they have to
I
be bought
don't have.
a prescription only or on
Yeah, yes.
consultation?
Yes, there are only practically in our country we have three medicine that is available and which are FDA approved for use for quit smoking. One is a nicotine replacement therapy, one is a varnicillin, and third is a bupropion. So these are the three drugs that is US FDA approved and that can be used and that is available. But this all has to be consumed after a proper prescription from a physician.
Okay, so if a
Over the
person
counters
has
are not very effective. Yeah,
Dr.
I mean,
Dipanjan,
I'm just telling that. Yeah, so over the counter, as Dr. Kripesh was mentioning, I'm not sure what medications are dispensed at the counter for smoking cessation. Mainly nicotine replacement, it can still be tried, but both other medicines, as Dr. Kripesh was mentioning, they definitely should not be taken without a valid prescription because they can have their own share of effects. And if you are not getting a prescription, simply taking over the counter medicines for quitting form of addiction can be extremely dangerous and
yeah,
avoided.
yeah. So
Because
quickly moving. Yes, Dr. Kripesh.
Yeah, because a smoking cessation has a different parts and component in doing it. Huh? It has a counseling part, it has a medication part, it is the person's own willing to quitness is all the part. But if the patient go over the counter to a pharmacy and just buy the medicine, other components of quit smoking is not involved. And
Okay.
actually, medicine or pharmacotherapy is the last part in quit smoking. So that's why the person who willing to smoke, they should get a proper counseling done before they try to take medication for it.
Okay. So while we're talking about de-addiction and also trying to quit smoking, Shweta Mishra is 25-year-old female. What can I do instantly to overcome that need to smoke at that moment? If I'm trying to quit, are there any quick tips that you want to give, Dr. Debanjan?
Yeah, I think one of the thank you for this question. In fact, this is one of the very cons that we face. See, what we usually mention is delay distract policy. So, if you are feeling like you are having extreme craving, give yourself some time. Try to go to a smoke free zone. Try to, probably, if you are at home, if you are at with your friends, if you are at place where you are able to see somebody smoking, leaving that place is probably immediate. The other very quick fix which works for some people is trying to have a candy, trying to chew something, because ultimately there is a restlessness orally in mouth also when you have this craving for smoking. It can be a sugar free candy, it can be anything that you like, and probably if you are in a state early in the morning, if you are in a state to probably go for running, go for exercise, you can do some free hand physical activity, instantly delays that need to smoke. It's even biologically proven. And also, as Dr. Kripesh was deep yoga, just very plain Surya Namaskara that we practice, sometimes visualization, relaxation technique, listening to a calming music. Will this totally help you quit smoking? No. But this will at least help you delay to that extent that you do not have just extra one, which will make you relapse.
Wonderful. Rahul Yadav, your question is also answered here. Any food or something else that I can do to delay? I think Rahul's question is answered. Dr. Kripesh, you want to add something here?
Yeah, I would like to add a very important thing: smoking and women's health. Uh, because now number of female smoking in India is going exponentially, and
Also, yes.
the yes, and they should know that it has a very ill effect on women health. The risk of lung cancer in women is almost 25 times higher than a non-smoker, and then it can have ill effect on the reproductive health. That it can have a low birth weight babies, and then pregnancy complication, miscarriage, then birth defects, and lots of pregnancy complication can, and infertility. Infertility is very rampant in our country nowadays. So these are the complications, and women health can be greatly affected by smoking.
Yeah. Dr. Kripesh, adding to this, is this also a
Yeah,
passive smoking women? This is not just the woman
yeah,
who's
it
smoking
may be.
herself.
Yeah, it is both related to your direct smoking and passive smoking. Both can equally be affected by this smoke.
Important point. Yeah, Dr. Debanjan ji, you can continue. One question to you. I would want to direct this question here to you. What about male infertility, diabetes, and smoking? And also, there's a question about difficulties of bowel movements while trying to quit smoking. Coffee and tobacco are both directly used to have that urge to go to the bowel के urge के लिए use किया जाता है. So these are the three questions that I want to divert to you before we continue.
Yeah, thank you. So, I was in fact about to just tell the first thing that you mentioned, male infertility. And in the practice of sexual medicine, many times when we see that people coming to us with sexual health problems, with erectile problems, problems with conceiving, even both in male as well as female, uh, smoking is a very, very important factor, and it is extremely linked even to obesity, diabetes, central obesity specifically, risk of stroke, as I mentioned, risk of memory loss or dementia. And what we have actually seen is that cutting down on the amount of smoking, and if possible, quitting smoking totally, tends to reverse most of these sexual problems. And sometimes, even without the help, like, we do not need any extra medicines for the sexual issues per se, because the risk of male infertility, especially erectile function, rises by almost 10 times with smoking and 3 times more if there is an added diabetes. And diabetes and smoking are actually interrelated. But the good thing is, these are reversible. And sometimes people come to us with sexual health issues, but then they are also willing to quit when they hear about this. And then it's good that we can actually target both things simultaneously. And again, the effect on women infertility, women reproductive system is much more, as Dr. Kripesh was mentioning, especially when it starts between 20 to 30 years age group.
Okay. Dr. Kripesh has one last question from audience that I would want to conclude. Before I conclude, Shiva is asking this question. There are tablets like Champix and Bupron, Bupron. Champix is now recalled. Is there a replacement available in India? He's a 44-year-old male smoking from last 16 years.
Yes, both the medicines are available in India.
Okay. So, but on prescription.
Yeah, on prescription.
Okay, so wonderful. I would want to ask Dr. Kripesh one quick question. If I'm a passive smoker and if I'm worried about myself and my health, how do I protect myself at workplace, especially at home? My father has quit smoking, and we're very happy that he did not need much help. But workplace, I am exposed to smoke quite a bit. So how do I protect myself? I try and walk out, but then I feel really very ashamed that, again, peer pressure of not being together with friends or co-workers. How do I safeguard myself? And what are the effects? So I also
Definitely.
get my test done.
Yeah, nowadays many of the places that the designated smoking areas are there, so smokers usually go to that. So that is one thing, and particularly this area that is full of smoke or smoking is going on actively. I think person should avoid those places. That can help, and if at all it's not possible, then at least wearing a mask can also help to reduce the amount of smoke inhaled. But
Great.
distancing from a smoker or smoking area is the only important point when you go for avoid secondhand smoke.
Wonderful, Doctor. Dr. Devanjan, quickly, the difficulties of bowel movement while quitting. What we haven't addressed that issue.
Yeah, sorry. So, yeah, I think it's a very important part of withdrawal effects. And as you rightly mentioned, a lot of people take smoking in order to induce bowel movements. So, if it is a regular habit, once they stop it, they tend to have bowel irregularities. Again, there can be nothing like good physical activities, simply walking, recommended for at least 15 minutes, a lot of water intake, and dietary fiber intake, because what happens is the bowel movements in general tend to get dependent on nicotine. And usually, if you make certain lifestyle changes, it tends to get back to normal within a week. So there's nothing to worry. It's not a permanent, irreversible effect. It can be reversed.
Yeah, and I'm running short of time for today's session, and I'm concluding the questions from YouTube. Before I take leave from you, Dr. Kripesh, I would want you to give us top tips, especially while we have gone through a pandemic collectively and we don't know what kind of damage that our lungs have gone through with the COVID virus. If one is affected with COVID and then is a smoker, if one wants to quit, how do I understand the damages and how do I help a person with all these symptoms, risk factors? Top.
Yeah, we have to look for the symptoms that can affect our lungs because of the smoking. If we have developed early symptom, at least we should take medical help. We do a regular health checkup that can also help us to get our lung checked regularly. And then again, I said previously also, quit smoking is the only way that can prevent our lung to be damaged further. And for this, we need to be motivated by ourselves, because without one's motivation, this will be impossible to quit smoking. And also doing regular exercises, yogas, and taking a good diet to keep our lung healthy is also very important.
Thank you so much, Dr. Kripesh. Dr. Debanjan, I want to quit smoking, but I'm unable to quit smoking. What are your pro tips on this?
Yeah, I think a lot of us do want to quit, but we are not able to. And that's so. Firstly, just know that this is a problem that you are suffering from, and you can take professional help that is available. There is nothing to feel guilty or ashamed about it. There are medications available on prescription. There is nicotine replacement therapy. Counseling and motivation forms a very important part. Avoid triggers. Peer pressure will always be there. But remember, be it first hand or second hand smoking, if you have to have a healthy lung, especially post COVID pandemic, you have to take care of yourself and your loved ones. If you feel somebody needs help and is not able to access, please seek professional help. Delay if you are having that craving, instead of that just one cigarette, which will again make you fall back in the loop. There are strategies to delay, which we have discussed. Engage in physical activity, take care of yourself, and other forms like healthy diet, nutrition, sleep. If you have mental health issues, them treated. Try relaxation techniques like yoga. And finally, remember, this is something that can be treated. If you even can't quit it completely, you can reduce harm and cut down on the number of cigarettes and reverse the adverse health effects. So seek help when it is necessary. We are always there to help you. Thank you and best wishes.
Thank you so much. And both the doctors can be consulted on Apollo 24/7 as well. Dr. Kripesh, we appreciate your time on this Sunday morning. And Dr. Debanjan, must say that it was a quite interesting session today with both the experts. Thank you again. So this is our session, and then we are also giving you discount vouchers. Please note that the coupon that we are giving is a new coupon. The code is ASKDOC150. That's AskDoc150. You can consult top doctors direct from Apollo, and you can have up to 150 rupees cashback on online doctor consultation. And the code you need to use here, it's changed. Please make a note if you're a regular. This is not the same coupon that we are giving away. This is a different coupon. The code is AskDoc150. Consult a doctor whenever you require. And the next coupon that we are giving away is first 3. The code remains same. You can get up to 25% off on online medicine orders, and this is up to 300 rupees on minimum orders of 800 rupees and above. So that's wonderful. You have to download Apollo 24/7 to use these both. And also to all our Health Hour viewers, here's your coupon. In case you are a Health Hour viewer and you want to use a coupon, here's the next coupon, HH247. Use this code and up to 199 off on doctor consultations with Apollo doctors, and up to 20% off on medicine orders. This is in addition to the earlier coupons that we shared. Please do use this code on Apollo 24/7. And next week we are talking about an interesting topic. Sabka problem hai, dental problems. How do we troubleshoot these dental problems at home, and when is it that you need to actually hit the dentist's office? So also, in case that you want to order medicines, if you're looking out for medicines or book tests, not just Apollo 24/7 app, you can also do it on WhatsApp. You can call or do a WhatsApp on 09355247247 to avail healthcare services. Do note down this number. It's quite an easy number, 09355247247, Apollo 24/7. Chaliye, so next week milte hai, and thank you all for joining us today. In case you do not want to miss any session from Apollo 24/7 and especially Health Hour, do subscribe to Apollo 24/7 channel, and also follow us on our Instagram and social media pages, Facebook as well, so that you get intimations and you get notified. Thank you all. See you next week.